So here is another list from the ACSM guidelines of some of the other medications that people who have Parkinson's disease may commonly take. And levodopa or L-dopa is at the top. And as you can see, a lot of these medications have lots of side effects. Really, the most important one for you to know is levodopa, but be aware that if you work in this environment, if you work with senior adults, you probably will become more familiar with a lot of these other different types of medications. There actually are surgeries that can take place for Parkinson's disease, and Michael J. Fox actually underwent these. So they do a deep brain stimulation, so it's almost like a defibrillator that's used for the heart, but they implant it within the brain. And so when people cannot have management of their Parkinson's by medications, and their Parkinson's symptoms are so severe, they will oftentimes go for this type of surgery. And it's interesting, it's adjustable, so it works very similar like a pacemaker or a defibrillator that would be in the heart, but it just tends to be in the brain. So again, it improves dyskinesia and motor function and quality of life. So people may have that, and they may need to have it turned off for certain types of testing. Exercise testing, exercise responses. So the L-dopa tends to cause bradycardia, so a lower heart rate, lower blood pressure responses. You typically want to test people an hour after they've taken their medication. So usually earlier in the day, they may have cardiac arrhythmias, so they're probably going to need ECG monitoring. And their medication changes can be unpredictable. So if they've had any changes in their medical routines, so you just don't know how that's going to affect their exercise. And interestingly, unfortunately, exercise may affect the medication responses and side effects, either for the better or for the worse. So, and if people have dyskinesias, exercise may not necessarily help that. So as we mentioned, testing 1 hour after medications. Cycle or arm ergometry is probably best for people if their balance is okay and they have decent function, they're in the early stages of Parkinson's. They can maybe use the treadmill. You may want to use a safety harness. Some testing laboratories will have that suspended from the ceiling. You could also attempt to do a 6-minute walk test and see how far they go. Definitely monitor ECG, heart rate, and blood pressure due to risk of cardiovascular disease. Strength machines, definitely okay. You couldn't do 1 RM. You may not get a very high 1 RM, or you could do a 10 RM. You could do the modified sit and reach, like from the senior fitness test, or probably use goniometry, which is maybe more ideal. Depends on what you have available. Look at balance, gait, fatigue scales, and then you can also do some of the functional assessments that we learned from the senior fitness test, the chair sit to stand, and the time up and go, the one that we did around the little cone. So let's go through the FITT recommendations for persons with Parkinson's disease. This is from right out of the ACSM guidelines as chapter 10. So aerobic exercise, there really isn't that much of a difference than with healthy adults. So, get 3 days a week, 40 to 60% of VO2 reserve or heart rate reserve. So moderate RPE, 11 to 13. So, really trying to keep them in the moderate range. Walking, cycling, swimming, or dancing. And what's really interesting here is they find that, certain types of ballroom dancing, like the tango and the waltz and the foxtrot, seem to really help people with Parkinson's more than Tai Chi, or, which is somewhat interesting. And then, of course, stationary bicycles, recumbent cycles, like we have upstairs, semi-recumbent, and arm ergometers will also work too. But it is very interesting about the ballroom dancing in Parkinson's patients.